In ICD11, we saw a term, the other specified psychoactive substance, including medication, which applies to psychoactive substance other than the 14 named substance group. That is corticosteroids, antidepressant, anticholinergic medications, and antihistamines. Diagnosis of disorder due to non-psychoactive substance are included, like laxatives, growth hormone, and over-the-counter medications and folk remedies, which in ICD10 is seen in abuse of non-dependence producing substance, which was considered separately. In DSM5, the categories recognized are substance use disorder, substance intoxication, and substance withdrawal. While in alcohol, DSM5 recognizes alcohol use disorder, alcohol intoxication, and alcohol withdrawal. But in caffeine, it does not recognize alcohol use disorder. It only recognizes caffeine intoxication and caffeine withdrawal. ICD11 has included Sir, X is what the categories which are recognized in DSM-5. Like in alcohol, we see alcohol use disorder, alcohol intoxication, and alcohol withdrawal is been recognized. But in caffeine, only alcohol intoxication and alcohol withdrawal is recognized. Similarly, similarly for cannabis, all three have been recognized. For phenylcyclidine, phenylcyclidine withdrawal has not been recognized. Similarly, for other hallucinogens, hallucinogens withdrawal have been not recognized. Inhalants use disorder and inhalants intoxication has been recognized. Opioids, all three disorders have been recognized. Similarly, for sedative, hypnotics, or anxiolytics, and for stimulants, for tobacco, tobacco use disorder and tobacco withdrawal has been recognized. Tobacco intoxication is not a diagnostic term in DSM-5. In others, all three have been recognized. ICD-11 has included new categories of psychoactive substance such as synthetic cannabinoids and synthetic catechins. These group of drugs are known as new psychoactive substance, that is NPS. Caffeine dependence was included as a distinct diagnostic category. This development of ICD-11 is in line with DSM, while in ICD-10, caffeine dependence was included as other stimulants and caffeine. In ICD-11, a category of dissociative drug has been incorporated separately, which comprises of phenylcyclidine and ketamine. In addition, the hallucinogen groups consist of MDMA and other related drugs has been separately mentioned. In ICD-10, there is no group of dissociative drugs. While in DSM-5, there are separate descriptions, but no categories for phenylcyclidine and other hallucinogens. In this, MDMA is also included in this category. DSM-4 and ICD-10 diagnosis of polysubstance dependence have been eliminated in DSM-5 and DSM-11. It is recommended in both systems to make individual diagnosis corresponding to the substance responsible for the disorder. Both ICD-11 and DSM-5 have mentioned a special note regarding prescribed opioid analgesic and sedative hypnotics and anxiolytics. DSM-5 affirms that diagnosis of substance use disorder not to be made for these drugs if only symptoms of tolerance and withdrawal are met. In DSM-11, tolerance and withdrawal are clubbed together in one criteria as a psychological feature. And even if someone fulfills this criteria, the diagnosis of substance dependence, which requires 2 out of 3 categories, would not be met for this opioid analgesics and sedative and hypnotics.
Can you explain this?
So basically, this concept has been introduced because of doctor shopping. Because what patients do is everybody has, for opioids, people will have a tolerance and withdrawal. So according to the previous system, anybody could be diagnosed with substance dependence. But DSM-5 and ICD-11 have separately mentioned these classes in DSM-5 that you cannot diagnose it if only tolerance and withdrawal are met. While ICD-11, the new diagnostic criteria for dependence, has clubbed withdrawal and tolerance in one feature itself. So it cannot be diagnosed in ICD-11 as well. In ICD-11, the categories used to specify clinical conditions are acute intoxication, harmful use, dependence syndrome, withdrawal state with delirium, psychotic disorder, amnesic disorder, residual and late onset psychotic disorder, other mental and or behavioral disorder, unspecified mental and behavioral disorder. While in ICD-11, instead of the categories, we see a primary diagnosis, that is single episode harmful substance use, harmful pattern substance use, substance dependence, substance intoxication, substance withdrawal, substance-induced delirium, substance-induced psychotic disorder, substance-induced mood disorder, and substance-induced anxiety disorder. While in DSM-5, the following conditions are classified as substance-induced disorder, that is intoxication, withdrawal, substance-mediated induced mental disorder, including psychotic disorder, bipolar and related disorder, depressive disorder, and anxiety disorder. The DSM-5 allows clinical to specify how severe or how much of a problem the substance use disorder is, depending on how many symptoms are identified. So it's not showing here the meeting window. No, so the meeting controls are not visible. Coming towards ICD-10, we identify the substance involved first, like if it is alcohol, it will represent F10, mental and behavior disorder due to use of alcohol. F12 will represent mental and behavior disorder due to use of cannabinoids. Then we identify the correct specifier by indicating the nature and severity of the problem. That is F10.2 will represent mental and behavior disorder due to use of alcohol dependence syndrome. F10.3 will recognize it as mental and behavior disorder due to use of alcohol withdrawal state. F12.2 will represent mental and behavior disorder due to use of cannabinoid dependence syndrome. While in ICD-11, the diagnoses are hierarchical and mutually exclusive. So only one can be diagnosed per substance group. That is 6C40 will be single episode of harmful use of alcohol. 6CA40.2 is alcohol dependence. 6CA40.4 is alcohol withdrawal. Similarly, 6CA41.2 is cannabis dependence. 6CA41.4 is cannabis withdrawal. The categories seen in DSM-5 are alcohol-related disorder, that is alcohol use disorder. So basically for a substance, like we can use alcohol dependence and cannabis dependence and alcohol withdrawal and cannabis withdrawal. For every other substance, there are dependence, withdrawal, like dependence, intoxication, withdrawal, induced delirium. This can be used for all the classes of drugs which have been given in ICD-11. While ICD-10 uses categories to specify the clinical condition, ICD-11 uses primary diagnosis for different substances.
Can be like, they can be opioid withdrawal state which actually does not exist. This category exists in ICD-10. Like it just should with the substance. So they've just made one thing. So basically we don't see delirium in many of the substances, but the categories for like any substance where they are specifically made for what substance can happen. So there, in ICD-11, there could be no category, or is there a category for opioid withdrawal in delirium?
Sir, they have no, sir. No, opioid with just they have given it different opioid withdrawal. Sir, I have mentioned it separately. There is delirium is given as a separate diagnosis. In ICD-10, we see harmful use, and ICD-11, we see harmful pattern of use. In ICD-10, diagnosis is made when the actual damage should have been caused to the mental or physical health of the user, while in ICD-11, diagnosis is made when repetitive pattern of substance use which has directly caused harm to the person or through the person's behavior to someone else. The main difference being is in it includes behavior by the diagnosed individual leading to the harm affecting another person as well. The harm to the health of the individual occurs due to one of the following: behavior related to intoxication, example, aggressive behavior; direct or secondary toxin effect on body, organ, and system; a harmful route of administration like injecting drug use.
Physical harm or mental harm?
So it both the harms.
ICD-11 specifies it.
So a physical as well as a mental harm caused to the person and as well as the person causing the harm to the other person.
Because it then says it mental or physical.
Yes,
whether
sir.
they have used this mental or physical.
Yes, sir, they have used. In ICD-11, there is episode of harmful substance use. This is a new diagnosis in ICD-11 which has not been seen in ICD-10 or DSM-5. An episode of substance use that has caused harm to the person's health or has resulted in behavior leading to harm to others. Harm may occur from intoxication, toxin effects on the body organs, or from harmful route of administration. While hazardous substance use is defined in ICD-11 as a health risk factor. As such, it is classified in a separate chapter that covers factors influencing health status or contacts with health services. This is a comparison of diagnostic criteria for substance dependence in both the ICD-10 and ICD-11 and substance use disorder in DSM-5. ICD-10, 3 or more evident sometime in the previous year, that is strong desire or sense of compulsion to take the substance, difficulty in controlling substance taking behavior in term of its onset, termination, or level of use, progressive neglect of alternative pleasure or interest because of psychoactive substance use or increased amount of time necessary to obtain or take the substance or to recover from its effect, persisting with substance use despite clear evidence of other harmful consequences, tolerance such that increased dose of psychoactive substance are required in order to achieve effects originally produced by lower dose, a physical withdrawal state when substance use has ceased or been reduced as evident by characteristic withdrawal syndrome for substance or use of the same with the intention of relieving or avoiding withdrawal symptoms. While in ICD-11, substance dependence is usually evident over a period of at least 12 months, but the diagnosis may be made if the use is continuous, daily or almost daily for at least 3 months. It includes 3 categories, out of which 2 should be fulfilled. The first category is impaired control over substance, example, onset, intensity, duration, and termination. Substance use become an increased priority in life such that it use take precedence over other interests or enjoyment, daily activities, responsibilities, or health or personal care. It takes an increasing central role in the person's life and regulates the other areas of life to the periphery. Substance use continued despite the occurrence of harm or negative consequences. Example, a repetitive relationship dispute, a negative impact on ill health. And psychological features indicative of neuroadaptation to the substance include tolerance, withdrawal symptoms, or repetitive use of substance to prevent or elevate withdrawal. As we see, tolerance and withdrawal have been clubbed together. Therefore, a diagnosis of sedative and hypnotics cannot be made, as I mentioned previously, because they have been clubbed together. So even if they are fulfilling it, 2 out of 3 criteria have not been fulfilled. Yes, sir. So they have just mentioned that they do not want sedative and hypnotics to be diagnosed if only tolerance and withdrawal is present, because they will a patient will go doctor shopping using that criteria. So that is why they have clubbed it together. In DSM-5, at least two of the following occurring within a 12 months period, that is craving and urges to use the substance. There is persistent desire or unsuccessful efforts to cut down or control substance use. The substance is often taken in large amounts or over a longer period that was intended. Recurrent substance use resulting in failure to fulfill major role obligations at work, school, or home. A great deal of time is spent in activities necessary to obtain the substance use the substance or recover from its effect. Important social, occupational, or recreational activities are given up or reduced because of substance use. Tolerance, a need for a marked increased amount of substance to achieve intoxication or desired effect. A marked diminished effect with continued use of same amount of substance. A characteristic withdrawal syndrome for substance or closely related substance such as benzodiazepine with alcohol is taken to relieve or avoid the withdrawal symptoms. Substance use is continued despite knowledge of having a persistent or recurrent physical or psychological problem that is likely to have caused or exacerbated by the substance. DSM-5 also estimates the severity. The presence of 2 to 3 symptoms out of 11 is defined as mild. 4 to 5 symptoms is defined as moderate. 6 or more symptoms are defined as severe. ICD10 and ICD11 has no exact counterpart to estimate the severity.
So there is craving in ICD11 in one that.
Sir, in the first.
Impaired control. So here only there is
Yes,
craving also. Control, second is not onset, intensity, duration, and termination. Onset, yes, okay. Next.
The next is preceding over other things. So third is tolerance and withdrawal.
With 3 criteria.
Yes, sir, 3 criteria. Out of 2 should be fulfilled.
Yeah, basically, it is easy because at times you have 5 because these are repeating. You have withdrawal and difficulty in control is also there. Craving and impaired control. Set.
In ICD-10, diagnosis of substance dependence have been dichotomous, either currently abstained or using. In ICD-11, it proposed remission specifier instead of abstinence. In DSM-5, dependence is specified by remission in terms of number of criteria met, not by abstinence. ICD-11 suggests a continuum model for recovery from substance use rather than a dichotomous model of the ICD-10. As we see in ICD-10, the specifier is currently abstinent but in a protective environment like in a hospital, currently on a clinically supervised maintenance or replacement regime like with methadone, currently abstinent but receiving treatment with aversive or blocking drugs, example naltrexone, currently using the substance, continuous use or episodic use. While in ICD-11, we see alcohol dependence continuous use, that is over a period of 1 month, alcohol dependence episodic use, that is during the past 12 months, intermediate drinking with periods of abstain, alcohol dependence early full remission, that is abstain from alcohol during period lasting between 1 and 12 months, and alcohol dependence sustained partial remission, that is significant reduction in the amount of alcohol for more than 12 months. Alcohol dependence sustained full remission is abstain from alcohol for 12 months or longer. And in DSM, we see early remission, sustained remission in a controlled environment or in maintenance therapy. In DSM-5, early remission is after full criteria for substance use disorder was previously met. None of the criteria for substance use disorder have been met for at least 3 months, but for less than 12 months, with the exception that criteria of craving or strong desire or urge or substance use. In sustained remission, after full criteria for substance use disorder was previously met, none of the criteria have been met at time during a period of 12 months or longer. and in controlled environment and maintenance therapies similar to ICD-10. In ICD-10, withdrawal state is one of the indicators of dependence syndrome. The ICD-10 diagnosis of substance withdrawal state with delirium is replaced by ICD-11 diagnosis of substance withdrawal specified with perceptual disturbance or an additional diagnosis of substance-induced delirium wherever appropriate. Therefore, in ICD-10, we see withdrawal state and withdrawal state with delirium, while in ICD-11, we see alcohol withdrawal and alcohol-induced delirium as a different diagnosis itself. In DSM5, delirium is covered in a neurocognitive disorder specifier. It will include substance intoxication delirium, substance withdrawal delirium, and medication-induced delirium. In ICD-10, the neuropsychiatric complications of substance use are included in the psychoactive substance use, that is withdrawal state with delirium, psychotic disorder, which includes schizophrenia-like, predominantly delusional, predominantly hallucinatory, predominantly polymorphic, predominantly depressive symptoms, predominantly manic symptoms, and mixed. It includes amnesic disorder and residual and late onset psychotic disorder as well. ICD-11 has many psychiatric sequences are listed under each substance. Like in substance-induced mental disorder compromises the following: substance-induced delirium, substance-induced psychotic disorder, which includes hallucinations, delusions, mixed psychotic disorder, and specified, substance-induced mood disorder, substance-induced anxiety disorder. So we will see alcohol-induced delirium and alcohol-induced psychotic disorder in ICD-11. The two disorders which only apply to psychostimulants in ICD-11 are substance-induced obsessive compulsive disorder and substance-induced impulse control disorder. In DSM-5, the substance-mediated induced mental disorder may be induced by the 10 classes of drugs which have been previously mentioned. They are described in their relative chapters. For example, neurocognitive disorder, depressive disorder, and anxiety disorder are labeled as substance-mediated induced condition within these sections. Like alcohol-induced depressive disorder is given in depressive disorders in DSM-5. And this is the summary of changes from ICD-10 to ICD-11. We see ICD-11 has included addictive behavior like gambling and gaming. The 10 classes have been further given as 17 classes of substance. It has described each class of substance clinical conditions. Acute intoxication is specified, severity has been seen in ICD-11. Independence, simplified diagnostic criteria is seen that 3 major features are given, out of which 2 needs to be present to make a diagnosis. Harmful use has been changed by harmful pattern of use, that is episodic and continuous. Added feature is significant harm to the health of other people. ICD-11 has added single episode of harmful use. In withdrawal, it has added perceptual disturbance. In psychotic disorder includes psychotic, mood, anxiety, sexual, sleep disorder, and obsessive compulsive disorder separately. It has moved out amnestic disorder and dementia, residual disorder, and late onset psychotic disorder. It has moved in abuse of non-psychoactive substance. Substance-induced delirium is outside the code of withdrawal syndrome in ICD-11. There's a revised classes of psychoactive substance seen in ICD-11. These are the references for the
Substance ICD-11 delirium is
sir. Yeah.
Okay. Like DSM-5,
yes,
delirium is a separate category and you have to classify that.
Yes, sir. Delirium is given a separate chapter itself in DSM.
You have to classify like medical condition or something.
Does that mean that alcohol delirium can happen without withdrawal?
No, so they have mentioned in ICD-11 that we can make both the diagnosis together itself.
If we want to make only alcohol induced delirium, that means that withdrawal is not there. We can say.
So they have said that you can make a.
Many a times this can
happen like a binge drinking.
Binge drinking, delirium, not in withdrawal. The patient has come in.
Yes, sir. They just decrease the amount then also.
You have to think about very weird scenario. That is why sort of withdrawal state, delirium. Yeah, right.
withdrawal के बिना
Any example of this single episode sample use? You can just give that example.
do you see patients like that?
So single episode. Yes, sir. If a patient has a increased amount of alcohol, they cause harm to somebody else, as mentioned in ICD11 that harm to self as well, sir. If,
That cannabis induced bad trip.
Yes, sir.
Patient comes there.
Yes, sir. They get anxiety the next day.
Also, they are brought the time, like you say, they are taking physical like first intake or second intake, when drinking or excessive amount, alcoholic induced gastritis. So that is also a bad hangover, or that can also come into that harmful simple use.
Lastly, this is your interpretation or taken it?
So I have taken it.
Very nicely put.
Questions from the residents? Hope you understood.
Yes. It was only in ICD10, ICD11 has removed it. Yeah, and so we can use unknown
If there
multiple.
are more than one or two substances, then there is an experience.
So in other unknown or unspecified.
No, it's unspecified. Is
So other specified.
we can make comorbid, I think. That
Yes,
somebody
sir.
having
They have written that.
opioid dependence, also pressurized dependence, then you will make a comorbid diagnosis.
So they are in ICD11. They mentioned to make comorbid diagnosis instead of
So I
making.
think this is right because we don't see at least one category will fulfill it. So ultimately we are not able to make a diagnosis. Maybe that is why they have taken it. Very unstable diagnosis. Important was very specific synthetic therapy. Maybe a few years down the line.
You have a question?
So I have a question about these new psychoactive substances. We haven't seen any of.
I'll prove you out. What question is what on?
So these new psychoactive substances.
Okay.
Sir, what is? We haven't seen any of these.
Ketamine, etc.
No, sir. These catenons.
Synthetic.
No, sir. The catenons. These are alkaloids. Also. So these.
Synthetic
Catenons.
Synthetic formulations of these illicit drugs. And in the US, so they are very, very available. Probenol and all.
LSD कहाँ पे आएगा? Ecstasy.
Hallucinogens. So I read it is a type of synthetic alkaloid. जो molly, the word molly used in movie represents catenons.
Yes. Basically, they are cousins of amphetamine and MDMA.
Where will your patient come? You know, we talk about the patient where you give a history of substance abuse and then. So ICD10 versus ICD11. Do you think it would be easier for you to diagnose in which category? ICD11. ICD11, it should be easier to just diagnose their alcohol-induced delirium, because that is also the case. Because that patient has a delirium, and it was not clear like whether that state started before the withdrawal. He was not absolutely even during that. So he was taking alcohol, and actually it started with some psychotic-like symptoms, which we were like it went away with the withdrawal went away. So that was there. Also, now you know that you have three criteria, so you have not to tease out tolerance, withdrawal, etc. You can very easier to make a diagnosis.
So neuroadaptation, one, neglecting pleasures, and inability to control. And then remission criteria. So we can see multiple
Even the reduction is now like partial. Reduced, like we see patients who are like in treatment, they are still abusing, and we try still abusing, so they remain in that category.
And substance dependence is a lifetime diagnosis. So if someone had a dependence maybe 10 years back, then you have to say that sustained combination. You have to put it in a diagnosis.
Why we currently sustained combination.
So that is why ICD11, I feel there is most comprehensive of all.
For substance abuse. It has the issues that were there at times. A lot of them have been resolved.
Plus, you missed one thing. ICD10 says 1 month in 12 months. 11 and DSM5 says at least 3 months.
Yes, in the diagnosis.
At least 3 months of a continuous pattern.
Also, your remarks.
Yes, sir. So in tobacco, it has been. So tobacco, it has been given in DSM and ICD10 and ICD11 is. Yes, sir. 6C4A is disorder due to nicotine. While in ICD10 and DSM5 it is tobacco.
It's tobacco and it is nicotine. ICD10.
So ICD11 is nicotine. This is ICD.
Okay, ICD11 is nicotine.
Yes. Yes.
Caffeine was included.
So caffeine is given a separate diagnosis only in ICD11 and in DSM5 was. Yes, sir. So in ICD10 it is with other stimulants including caffeine.
So independently.
Yes, they have given an independent diagnosis. Like in DSM5, they have kind of followed a DSM5 approach. So that so this.
Have you ever seen some patient coming with 5 Estelopram I'm having, or I'm having 6 or 7? Like antidepressants, abuse.
Yes. So in emergency, but not so just one intake.
Overdose.
No, sir, not abuse.
Have you know abuse in it? The patient anticonvulsants we have seen.
Steroids.
Steroids, pregabalin, carbapenem, they do antidepressants. I think we presented. Share this PPT, very important, because this is what we want. When we come out of this with more clarity and among 3 ecosystems, and then we feel motivated to adopt them. So because of the old forces we are. Thank you so much. Thank you very much.
Thank you.
क्या मैं इसको वो कर सकती हूँ? मुझे पेपर प्रेजेंट करने के प्रेजेंट कर सकती हूँ? है और बनाना कैसे पेपर? आप बताओ. ये जो आप आर्टिकल बता रहे तान्या अपना मेल लॉग आउट कर ले। और मुझे लग नहीं रहा वो रिकॉर्ड हुआ है, क्योंकि वो मीटिंग में तो पहले मैं तेरा मेल बंद कर दूं। तो मैं तेरा मेल बंद कर रही हूँ पहले। सुन, राउंड कौन लेता है आज? अरे यार मैं जा रही हूँ। मैं बोल तो रही हूँ मीटिंग बंद करने का ऑप्शन नहीं आ रहा है। तो आप मुझे हेल्प करोगे करने में? मुझे करना नहीं आता। मैंने बस तान्या और आयुषी को ही दे रखा है और किसी को नहीं करा। ठीक है।
ओके, अपनी ओर के सही होते
एंड कर दूं ना मीटिंग?